Hello, it's Rick Phelps. I wanted to do a video today about the dreaded topic of placing a loved one in a facility has come up again, which is good. It's a very important topic and one that needs to be discussed time and time again. I need to make a disclaimer here. Just remember, anything that I ever post or in these videos are just my thoughts, my opinions. Nobody has to agree with them or go along with them or anything, It's a very personal decision about placing someone in a facility, and one that needs to be taken seriously. That being said, I tell you this, in my years at EMS, 24, 25 years, I had the opportunity to transport many Alzheimer patients, dementia patients, and what have you. And I can tell you without doubt, I would say 70 or 80% of them I transported from their home should not have been there. They should have indeed been placed in a facility long before we were ever called into the picture. I think what happens is people, like we've discussed before, people make these promises years go. Well, I promised my mom that 30 years ago that I'd never put her in a nursing home, or 20 years ago, or whatever. Well, I say, hooey. Trust me, these are things that are said that are meant and well intended at the time, but things happen. And with this disease, it just progresses. And when I see people post about placing their loved one and talking about it and things like that, I have to stand back and think the time has probably come already. I've said time and time again that, there is no downside to placing your loved one too early, but there are many downsides to waiting too long or placing them too late. I worry about people, wandering or patient falling, or, let's just take a 160-pound male patient or a 160-pound female patient that's in their 60s or 70s or whatever, and the wife or the husband is trying to handle them, in the middle of the night, 2 a.m. They have a bathroom accident, or they need to go to the bathroom and you can't get them there, or you're trying to get them in the shower. There is a host of things that can go wrong, and none of them are good. And this is going to go on day after day after day. The things that you have to go through as a caregiver at that point in time is relentless. I mean, and when the decision is made that you think maybe your loved one needs to be placed, there are things that needs to be done way in advance of that. One should always go to the several facilities in their area and check them out. Look at the rooms and talk to the staff and talk to the family members in that facility, and get a good feel of it. I always feel that when people post about placing a loved one, that I wonder how many facilities they've ever been to, because I'm telling you, I know what they used to look like 20 years ago, and I know what they look like now, and there's no comparison. You used to walk into a nursing facility or an Alzheimer's facility, and you could smell urine and other things and medication, and it was just horrible. We don't have that anymore. You don't have that around here, and we live in a small community, so my guess is you probably don't have it anywhere. There's all kinds of activities that these people can be involved in if they want to. I'm telling you, it's a good thing, putting these people somewhere where they can be cared for 24/7 like they should be. It's dangerous keeping them at home, and when one does that just because they made a promise 20 years ago, it's just not the right thing to do. You're just not thinking clearly. If something would happen, this patient would fall or whatever would happen, you'd never forgive yourself. and also there's, like I said, there's many things that needs to be done prior to placing a patient. First of all, the doctor is the only one that can do that. It has to go through your doctor. The facility has to have room for that patient. You got to make financial arrangements as far as they're going to accept the insurance that you have, or Medicaid, Medicare, whatever that is. And the patient indeed has to be in a state to where they need to be placed. It takes a doctor's approval. There was something else I was gonna. Oh yeah, and then before the patient is placed, get the room ready. Have everything there that you could possibly get in there that is their own. Comforters, pillows, blankets, pictures, music, a chair, their favorite chair, pictures, just anything that would make them feel at home. And that will ease the stress and all that of the patient being in a facility. Now, this is not a good thing for the patient, obviously. I, as a patient, know very well we don't do changes. And geez, that's a huge change. But whatever the patient says and whatever they do, and they lash out and all that stuff, remember, it's a brain disease, and they're not going to feel that way within 2 or 3 hours. And possibly the next day they'll feel worse, or they could feel better. But you just have to keep in mind that you're doing the right thing for the patient. I've said many, many times, it's one of the most loving and caring things you can do for your loved one is to place them in a facility, because you're doing something that you don't want to do, that you think the patient doesn't want you to do, but in your heart it's the right thing to do. So they will get the proper care. Dementia, this disease, this brain disease is much more than people sometimes tend to realize. I mean, all your faculties shut down, and it's just, I don't see, I personally don't see how anyone could care for a loved one unless they have the opportunity, the means, and financial things to have 24-hour care at their home, or be with this patient 24/7, because that's what it's going to take. And not very many people I know have that ability, but if you do, that's fine. If you can keep that patient at home and you can care for them the way they should be cared for, I say, that's the thing to do. But in many, many cases, that's not the thing to do. And some of these people are, I've seen cases where people were kept at home just so the family would have access to their funds. They don't want to spend that money that mom's got or dad's got or whatever. I mean, this happens. People don't like to talk about it. They don't like to admit it, but it happens. And that indeed is wrong, but it's a life it's just the way it is. So I wanted to talk on that a little bit this morning. I know it's been brought up in memory people way many times before, but just try to keep in mind that I know it's difficult. It has to be difficult, but it's the right thing to do. Nobody will ever convince me that it isn't, and I'm a patient, so keeping a loved one at home because you made a promise, or keeping them at home because they don't want to be placed, well, that's just not the right thing to do. It's not. Something can and will happen. It's Newton's law. And I know there are people, unmemory people, adamant people that are patients that say they never want to be placed in a facility. And that's okay. That's okay. But the reality is that someday the family members are not going to be able to take care of them. And that's just the reality of it. Unless you have the means, like I said, the financial means to bring in 24/7 care, It's just not feasible. It's a disease of the brain, and everything the patient does at the later stages, everything the brain affects. They'll forget how to eat, they'll forget how to swallow, they'll forget how to go to the bathroom, forget how to walk, forget how to talk. I mean, all the things that your brain does for you will not be right. So keep that in mind. But once again, these are just my personal opinions, and everybody's entitled to their own. And I wish everyone could have their loved one at home as long as possible, but I know in some cases it's just not possible, and in other cases it is. So it's an individual basis, and but please don't feel you've lost this battle or whatever if you have to place your loved one, because in essence you've won, because they're still being cared for, and they're being cared for a lot better than maybe what you can provide. Never feel bad about placing a loved one. And these people, you got these family members that say, oh, you should have never done that. Well, they don't. They're not there. They're the ones that pop in once a week or once every 2 weeks for an hour or two, and they got no idea what's going on. You all know who I'm talking about, because every family's got them. So they don't even have a say in it as far as I'm concerned. So, all right, I've rambled on. Have a good day and have a good weekend. Peace.